Hi guys, welcome back to my channel. Thank you so much for clicking on this video. If you are new here, welcome. My name is Aminata. I am a family nurse practitioner. And if you're a returning viewer, thank you so much for coming back. Appreciate you. And this video today is a two-part video. The first video I talk about what are some tips that you need to do to be able to be successful in nursing school? And that first part focuses on the classroom aspect of it. And this second one is going to be focusing on the clinical aspect of it because you need to be successful in both to make it through nursing school. So today, one of the first things that I wanted to talk about is as a nursing student, when you're going into clinicals, always make sure you prepare ahead of time. There are some schools, for example, when I was a clinical instructor, the school where I was teaching requires the student to go in a day ahead of time and look up their patient's information. That involves their diagnosis, the treatment plan, medications that they're on. So that way the student can go back and look up that information prior to clinical, so that way to get a better idea of what's going on with that patient. So make sure you do that. And if your school doesn't require, ask them if that's something that you're able to do ahead of time. If not, that's okay. All you have to do now is make sure you go to clinicals way ahead of time. A lot of the time your clinical instructor will be there on time to make sure they make the assignments for you and figure out what nurse you're going to be working with, so that way when you come in they tell you who your patient is and what nurse you're going to be working with. And that also gives you the opportunity to be able to meet your nurse ahead of time, especially for most nurses. They go in ahead of time. They're on time, or they go in a few minutes early because they need to look up information about their patients as well. So that way you get to meet your nurse, and then you can kind of figure out a plan together, how their routine is, so that way you know how your day is gonna go. So make sure you go way ahead of time. And then the third thing that I want you to really pay attention to when you're in clinical is that be willing to do whatever it takes to help out. Be as helpful as possible. And that involves doing a lot of the things that you might be doing as a nursing student, involves you doing CNA type of work, which involves helping the patients walk, getting some water, answer call lights, which is okay because that's something that you're going to do as a nurse anyway. So making sure that you know that CNA work or jobs that CNAs usually do, those are things that you're going to be doing too as a nurse. So why not start now, honestly? And that's one of the fun aspects of nursing, to be honest with you. A lot of time involves you getting water for patients or helping them go to the bathroom. Just make sure you always check in with the nurse that has that patient or with the CNA, and so you know how that patient transfers. So safety always first. Even if they ask you for water, it can be something as simple as water. Some patients are not supposed to have water, and they will try to get you as a student. So make sure that usually they will write it on the board, the patient's diet and how they ambulate. Sometimes some of those things changes because maybe they did not update the board in the patient's room. So make sure you ask the nurse and the CNA how their patient transfer. Are they allowed to have water and all that stuff? So make sure you're willing to do work that are not necessarily quote unquote for nursing students, especially for some of the nursing students that are a little bit closer to being done with their program. Sometimes they feel as well, I need to be passing medications, or I need to be doing this. That's okay. You're gonna have a lot of times to pass medications when you're a nurse, and when you're a nurse to do nursing stuff. So make sure just find a balance between not being so caught up with certain things that you feel as though they're more nursing student related, and other things that you feel as though, well, the CNA should be doing this. Because what happens is, for a lot of the nurses, when they see you being helpful with doing things that they might not necessarily have to do anymore because you're there to help them out, they're more willing to teach you and be more willing to help show you certain things. So for example, like, hey, do you want to come watch how you do a Foley? And don't be afraid. Make sure you check with your clinical instructor if you're allowed to do it, whatever the procedure is. Check with your clinical instructor and make sure that it's okay. But a lot of the nurses are willing to teach you when they see you putting in the effort. And then another thing that I really want to stress out that's going to be very important for you to be successful is learning not to take things personal. So for example, when you see there's some nurses that maybe a nurse that you're assigned for the day may seem like quote unquote they don't want to be bothered. A lot of the times it doesn't have anything to do with you at all. It's just maybe their personality. And a lot of the time as a nurse, it can be really stressful because your workload is a lot. So some nurses don't necessarily know how to balance getting their work done and also being able to teach someone, because it does slow them down. That's something you need to understand. When you are a nursing student and you're working with a nurse, you are going to slow them down. And that's just part of the process, because at some point they went through the same situation where someone had to teach them. So that's okay. If you seem like you're slow in doing things, that's perfectly fine. Don't even worry about it. That is why you're a student. That's the beauty about being a student, is the fact that you get to use that. You're still learning. You're still in the learning process, okay? But really, truly, on a more serious note, try not to take anything personal, especially when it comes to you working with the nurse. And a lot of the time it's because they're just busy. They're trying to figure out different things. And sometimes they're already busy and then they get an admission. So they just want to try to get as much as possible done. And sometimes it may look like they don't want to teach you, and that's not the case. Every now and so, you may get one of those nurses that really, truly don't want a student. And that's okay. And all you do is just talk to your clinical instructor about what's going on. And maybe if just for that day, you can be the wingman to your clinical instructor, where you get to follow them more, and they get to do the stuff that the nurse was supposed to do with you. That's okay. So just communicate with your clinical instructor, whatever it is that's going on, and don't take things personal. So overall, in a nutshell, some things that you need to do to be able to be successful is, if you're able to go in a day ahead of time and look up your patient information to be better prepared for your clinicals, make sure you do that. If your clinicals doesn't allow that, go at least 10 minutes ahead of time, so that way you get to meet with your clinical instructor, know what your assignment is, talk to the nurse that you're assigned to, and kind of get a feel of their routine and how the plan of the day, and that helps you better prepare. Secondly, you want to make sure you're willing to do whatever is it that it takes for you to be successful. That involves you being as helpful as possible. So doing things such as CNA work, to be able to be as helpful as possible to the nurses, and that way they'll be more willing to help teach you. And then the other thing that you also want to do is make sure you don't take things personal, and be willing to say that you don't know things. If there's something that you don't know, it's okay. That's why you're a student. So if a nurse asks you to do something and you don't know how to do it, just ask them to teach you, so that way the next time now you know how to do it, you can go ahead and do it on your own. So just again, don't take things personal. If you have a nurse that seems to be a little bit difficult or doesn't seem to be receptive about teaching you, go to your clinical instructor, and you guys can talk about it, and then they can figure out a better plan on how to go about helping you. And that's pretty much it for this video. I hope this video was helpful. If you have any tips on things that you're using to help you be successful in clinicals, please make sure you comment down below, so that way we can learn, as I have some nursing students on this channel, so that way they can learn, and I can learn too, honestly. And even being as a nurse practitioner right now, there's sometimes where you have a student, so that way maybe there's certain things that I need to do differently to be able to help a student that I'm precepting. So yeah, overall, I hope this video was helpful. Make sure you like this video, comment down below, and don't forget to watch the part 1 of this video that talks about how to be successful in the classroom aspect of it. Until next time, take care guys, and I'll see you in my next video.